students, my name is Apokin Alexander, and I welcome you on our Rubberdamology YouTube channel, where we can discuss and learn the practical aspects of using rubber gum isolation system in the mouth cavity of your patients. Train your hand skills and study it for free in international interactive format. We're starting this series of exercises. For using lower jaw model from the company MedSkills. And we discuss with you some aspects of the basic isolation of molars, premolars, and incisors on the lower jaw. Open our rubber gum plates. We're using Nicton medium. Nicton thin. Start to attaching rubber gum to your metal frame. Hold the angle of your rubber gum plate and the one upper left angle of your metal frame. Small tense the right up angle of rubber gum, then down right, and then fix upper left and then bottom left angle. You have small tense of rubber gum plate around your metal frame. Very good. During our practical work, we need some material during working with our lower jaw to cover your upper jaw and frontal incisors of the upper jaw. So we did not use rubber gum and don't make perforations higher than this quadrant. This is area for lower molars, premolars, and incisors at the edge of this metal frame. Start to applying isolation from tooth 36 to tooth 34. We have anchor clamp placed on tooth 36, and we made three perforations in this rubber gum plate. Don't do it very close to the left part of your metal frame. It's very good if you're working only with one side. It's enough to you to work at the center of your rubber gum, but I divide this part on two, the middle and half of this right or left part. All details about template-free methods of perforation and punching these rubber gum plates I made for you sometimes later. Today just made perforation with the medium size or big size of hole for molars. 36. Switch twice for hole for premolar and make two perforations. If it's comfortable, you can continue to work from this direction. But it's very efficient is sometimes to work from the bottom side. We have three perforations for three tooths. Let's choose what type of clamps we use. One of them are wingless. This is very useful in very many cases, and this is my favorite for anchor clamp in 90% of cases. This is wing clamps, number 7. This clamp W3. All cases, and this is I use only for endodontic because it have very big wings and I have not enough space to working with matrices, rings, and so on. Let's start one variant, first variant of fixation. We have working with the clamp number 7. All clamps packed in individual sterile packs. Today we work with them in clinic and start with the testing the stable fixation of clamp on selected tooth. Open clamp. If you wish, you can use the stopper to reduce the tension of your muscles in your hand, and very gently release this clamp from clamp pillars. Release your stopper, remove instrument from the mouse cavity. Then check stability with your finger. Then check stability with your finger, and if alright, you can remove it. The next, you need to check interdental spaces, if it's possible to place rubber down there. I'm using floss, and we start interdental flossing. I switch my camera. Good. Let's start interdental flossing. This is very painful for your patient. This is not good. I don't like it. But I'm using very small part of floss to make this is more comfortable, but because you can stop your movement with your fingers at the occlusal surface of this tooth. It's very comfortable. Also the same for hygienic book rows. We have very good interdental spaces, and we can apply rubber dam isolation. If you're starting to work with rubber dam, maybe you like to work with clamp that have wings. Place this clamp to your finger and insert stretch one perforation for anchor clamp with your fingers and put one wing inside, such way. Then hold your perforation and tense and stretch this hole inside the rubber dam plate to the other wing, like this. You have two wings on the clinical side of rubber dam plate and two in the inner side, inner surface. Release these bottom fixators, and if you're working on the left side of your model, I hold my frame to the bottom right angle. I collect the angle of my rubber dam and this free angle of rubber dam frame. Then insert clamp into the clamp pillars and slightly pull this stopper. It's very good because I can release all my hands and I have enough time to check my patients, any other aspects, and I can hold it with only one hand. Then sometimes you can make mark with a marker on the surface of these tools. Let's check what is this. If it's hard to remember or you cannot recognize the shape of these tools during your work, make a small black dot on these tools. Then, when you're working in your mouse and you start to isolate, you place your rubber dam and you did not find black mark on your occlusion surface, you choose the wrong tooth for anchor clamp. This is the mistake. Replace it to tooth number 36. Very good. You have black mark on this occlusal cuspid and you placed your clamp correct. Then start to fix angles of your frame and the rubber dam plate. Very good. Then you need probe to release these parts of rubber dam from the wings. I use always a clinic sharp therapeutic probe. Very simple. Insert it under the rubber dam hole margin and start to pull out. Very simple movement from both sides. Then we need to invert rubber dam into interdental spaces. In sometimes when you start working with the rubber dam, it's very hard to make all this work only with one clamp, because you need help of assistant, you need to attach every hole in a rubber dam to selected tools, and sometimes I have dry surface of plastic and my rubber dam don't move. But in mouse you have salva and very low friction. So you need help to have additional clamp, and we discuss it in the next part of this exercise. Let's see what we receive. In this area I have very strong rubber gum, and my rubber dam don't cover it. The same situation you can have in real life, and you just need very careful open clamp, pull it up and fix it. Very good. Let's try to invert. Make inversion. Insert floss inside interdental space between tooth. Hold it with one of your hand and you have a cross. With your probe, insert to the periodontal area and then move your floss like this. So you have inversion. Very simple. Remove. Let's see what we receive. very good inversion from all sides of tooth. Let's try to set up the same isolation on the right side of this model and use additional clamp for premolars to have easier displacement of these holes around this tooth. But as you remember, every exercise will finish with the making envelope around our metal frame. It's very easy, and we have different type of envelopes. Invert the free margin of rubber gum plate inside from the left side, pull, and very small pull it down to have tension at this side. Hold it with your fingers. Pull the free angle of rubber gum up and cover your upper left angle of your frame. Hold this part of rubber gum inside and release your finger. Repeat it from the right side, or you can do it synchronically with your assistant. Remove your finger and hold this inner part of rubber gum. Then invert this inner part outside and fix it to the angles of this frame, bottom angles. Very easy. You have very comfortable work in future for your patients, for all your clinical situations, and you have enough rubber gum to cover the upper tooth of your patient and enough space to work with your handpiece inside this area. Very good. The first part of this exercise is finished. Let's make the other exercise and release this rubber gum out from tooth, model, frame and clamp. Remove clamp. Release the frame and pull out this rubber gum. It's completely damaged. This is a single-use only accessory in your dental practice. But for education use, you can rotate to 90 degrees and continue to work from the other side. Let's start. Fix this rubber gum plate to the top left and right angles of frame and to the bottom. We're working with the right side of our model, so we did not look at this damaged part. It's no matter for me. We need perforations from the right side. But in clinic, you can replace this damage at the rubber gum plate. Make perforations for, let's use and isolate tooth 47, 46, 45, 44, that's enough. And maybe 43 canine. Perforation with the big diameter for molar. We pass maybe millimeters between the edges of these perforations. 46. For more comfortable work, rotate and switch perforation from premolars and make the next hole 45, 44, 43. Very good. Not from the direct straight line, but like a curve. Start to test our clamp on the model. Fix the clamp number 7 on the clamp pillars. Always start with the anchor clamp. You place it in mouse and very gently fix it on the neck of this tooth. Then we use additional clamp because we need helpers during this work. I'm using clamp number 2 for premolars. Anchor clamp is always turned with the arc distally, but additional help clamp always use rotated with the arc mesial to the lips. Fix your clamp to the clamp pillars, slightly open, fix the stopper, and then place it to the neck of your canine. Very good. Check the stability of this clamp with your fingers. Very good. Then you can remove all clamps or immediately check interdental contacts. If it's possible to pass through it. Very good. We have 1, 2, 3, 4, 5 tooths, 5 perforations in our rubber dam, and we remove our clamps. First remove the additional clamp, then at the last remove anchor clamp. Fix both clamp in the rubber dam plate the same way you place it on the tooth. Distal direction of the arc of anchor clamp at the hole for tooth 47. Hold it like a ring. Stretch the perforation and cover both wings, right and left of your clamp. You have 2 wings at the patient surface and 2 small wings to the dentist surface. Additional help clamp to the mesial perforation to canine. Rotate this arc mesially. Hold it like a ring and insert one of them inside. Stretch and fix both wings in the one perforation. You have 2 wings in the inner side of plate and 2 at the outer. Start fixation with the anchor clamp. Fix it in your clamp pillars, fix the stopper and release the bottom angles of frame. If you're working with the right hand, you can hold it with the left hand, right angle of frame and the angle of your rubber dam plate. Place it in the mouth. Ask your patient to open your mouth and place to the last distal tooth in this side. release your clamp pillars and fix your rubber dam plate. Very easy. Now you need to pull your rubber dam and fix your additional clamp to the canine, tooth number 43. I think this is not also hard, but you have equal distribution of holes around these tooth. Release this rubber dam plate from wings of your clamps. First, then from clamp number 7. Don't forget to make this from the both wings, vestibular and lingual side, and then search for perforations for raw tooth. Okay. Start our inversion. You can remove your floss to the side, not back up, but to the vestibular side. It's more useful. Sometimes you need help with your probe. And continue to inversion. And then the last one is tooth number 44 is ready. Don't forget to make inversion between clamp, canine and incisors at the medial side. Very well. Let's make some inversion around molar. Cross your floss and slightly move to different sides. You have very good inversion and you're able to work with the cervical area in some cases. But in future we discuss additional clamps to working in the cervical area of the tooth of the lower jaw. Repeat inversion around premolar. Also cross your floss and remove it. Very good. And the last one, also repeat inversion. And after that you can remove additional clamp, you don't need it more. And remove your floss. I think in your real clinic work you don't need additional floss ligatures to fixation. Sometimes when you have very big diastema between canine and incisor, you can make widget to fixing your rubber dam, also from rubber dam. Cut very small part, some about 1 centimeter to 3 centimeter. Make the widget very easy and insert in interdental space between incisor and canine. If you're afraid that your rubber dam pull out, let's check it with the upper jaw. Very good. You have enough space to cover your upper tooth. And to finishing our exercises, we made envelope around this frame. Very fast, I explained it to you many times. Making an envelope slightly pull down, fix and cover with the free angle of Rubberdam and made inversion outside. Let's check it with the upper tooth. Very good. You have enough space to working with your handpiece. Have additional, maybe you have also something like this in your mouth, but because you have upper lip in this part. But for training, you have very good space to work, because Rubberdam isolation is the first of all space for your clinical work, safeness for patient, and you have always dry area of your working surface on your hard tissues on the treatment tooth or treated tooth. I think we have very good exercise today. We're starting to work with the lower jaw. Thank you very much for your attention. Please don't forget to make questions in the comments below. Like this video and share it with your friends and colleagues. See you next time. Thank you very much.